Hello everyone, welcome to today's Nugget. And today I'm excited to discuss proton pump inhibiting medications because many people are placed on these medications whether or not they need them. What does that mean? Well, there's many people, it's very common for people to go into their conventional medical doctor's office and report symptoms of heartburn or acid reflux or gastroesophageal reflux disease is usually the diagnosis they're given. And so if the patient walks into the office and says, "Doc, I'm having some heartburn or I'm having some reflux when I eat," oftentimes there's not any examination done, there's not any laboratory testing done, there's just a prescription written reflexively for what's called a proton pump inhibiting drug. And the reason the proton pump inhibitor is given is because conventional medicine sees heartburn or acid reflux as too much stomach acid being produced. So literally you're eating and your stomach is overproducing acid, which would reflux up into the esophagus and cause some burning and pain. And the acid is hydrogen ions, and those are produced through a hydrogen potassium ATPase pump. So the proton pump inhibiting drug is trying to block those proton pumps from happening, from producing the acid, thus lowering your stomach acid secretion and hoping to lower the acid entry into the esophagus and the burning and the pain. The problem is that sometimes, and in the functional and integrative medical world, some would argue many times, more often than not, the GERD or the reflux is due to too little stomach acid, not too much. And so if you give a proton pump inhibiting medication at that time, you're driving stomach acid lower, and now you're increasing susceptibility to, say, maybe Helicobacter pylori infection, which is a bacterium that loves to colonize the stomach, decrease stomach acid to make it more hospitable for itself to live in. But that bacterium is related to stomach ulcers and stomach cancer, so we don't like that. Also, if you are decreasing stomach acid is needed to digest your protein. So poor protein digestion could lead to protein that is undigested moving into the small intestine, where bacteria can ferment it and produce gas, bloating, diarrhea, constipation, and maybe result in SIBO, or small intestinal bacterial overgrowth. So that's just a couple of the nuggets to talk about here, and I got a little bit ahead of myself because I first forgot to mention our disclaimer, that is, this is information purposes only and education only. Don't take any action on today's call without first speaking to your primary care physician. All information is up to date as best as we can to today. If you're watching this in the future, make sure you get the most up-to-date information first before moving forward with anything. So, proton pump inhibiting medications. These are medications like Nexium, like Prilosec, Protonix, omeprazole. So these are some of the most commonly prescribed medications for stomach acid issues like heartburn, reflux. And oftentimes I'll have patients come in and they list these medications on their intake forms, and I'll ask them, "How long have you been on this?" And they'll say, "Oh, for years." And I ask them, do they realize there's a black box warning on these medications that states they shouldn't be taken for more than 2 weeks at a time? And they're often very surprised and say, "No, and my doctor didn't tell me that either." And so whether right or wrong, that's how it's often happening, at least in my office. So it's important to follow the black box warnings because those are there for a reason. Those are there to protect people from injury. And the proton pump inhibiting medications, or PPIs for short, are rife with a list of potential injuries, and I just want to walk you through the research today to show you some of them. Now, the first study I want to look at is one that was in the journal International Psychogeriatrics in 2017, and what they did is they studied proton pump inhibiting medication and its association with depression in the elderly. And you can see here in the study that they found that the higher the proton pump inhibiting dose, the higher the association with probability of depression in the elderly. And this was independent of the diagnosis of peptic disease as well as antidepressant medications. So even if the elderly didn't have any stomach disease and they were on antidepressant medications, the depression was driven worse by being on the PPI. And you'll see in red here that 14% of depression cases could be avoided by withdrawal of these medications from the geriatric population. So let's think about that. First of all, depression is a non-specific symptom, which means just because someone is depressed doesn't mean we know where it's coming from. Oftentimes in conventional medicine, a doctor may hear depression and they're trained to go straight to psychiatric medications, right? Because we assume that it's all coming from the head. But you could be depressed for many reasons. You could be systemically inflamed. You could be, you could have GI disorders and have gut-brain loop mechanisms. Your dog could have just died, in which case depression may be normal there. So you don't want to necessarily reflexively give antidepressant medications. Just like you don't want to reflexively give PPI medications if stomach acid symptoms are present. Stomach acid symptoms can occur due to overproduction of stomach acid, underproduction of stomach acid, as we've talked about, presence of H. pylori infection, presence of stomach autoimmunity, immune imbalance that promotes a Th2 phenotype, which promotes histamine and eosinophilic issues. So there's multiple things that would need to be investigated before reflexively giving a medication, at least in my mind. And so if you look down here, it says 40 to 60% of all proton pump inhibiting medications have been proven inappropriate. Well, that means we're increasing risk for all of the people that are inappropriately prescribed these medications. If they're inappropriately prescribed to someone, then that person is receiving 100% risk from the medication and no benefit because it was unnecessary. So as this study shows, one of those risks in the geriatric population is increased risk of depression. And we don't need increased risk of depression in anyone, especially today while we're still in the COVID pandemic and people are locked down, being forced to wear masks, being fear marketed to every day about the numbers increasing. The depression's already there. So if someone's on PPI medications, it could be even worse. Next study here. Excuse me. Next study here is, this is 2019, and this study was looking at estimating the all-cause mortality and cause-specific mortality associated with proton pump inhibitors in veterans. So does risk of death from all causes and specific causes go up in association with proton pump inhibitors? So they studied veterans in the VA, and they looked at over 150,000 people that were newly prescribed PPIs. And what they found, in short, was taking proton pump inhibitor medications is associated with a small excess of cause of specific mortality, including death due to heart disease, kidney disease, and upper GI cancer. The burden was also observed in patients without an indication for proton pump inhibitor use. So if you fit criteria for needing the medication, there's a small increased risk of death from heart, kidney, and GI cancer. If you were inappropriately prescribed the medication, that increase was also present. So some people would say, well, it's just a small increased risk, who cares? Well, you know, some of the argument about COVID not being a big deal is, oh, not that many people are dying, you know, it's less than 1%. But then there's people on the other side saying, yeah, but my dad was one of those 1%, or my aunt was one of those 1%. So you can't say, you have small matters or it doesn't, right? So the you know, you could imagine that the companies who may be sued for someone dying because they were inappropriately prescribed the PPI would say, oh, it was just a small excess, no big deal. Whereas the family who was impacted says, well, that small excess was large in our experience. So we don't want to ignore small numbers. And this study found that it was important. So it's good to know if you're going to take a medication, what are the benefits, risks, and alternatives? If you're going to take a supplement, what are the benefits, risks, and alternatives? If you're going to have a surgery done, what are the benefits, risks, and alternatives? Because unless you receive that informed consent, you are being potentially put at risk for an experience that you weren't looking for. Now, relative specific to COVID here, a study was put out recently that found that proton pump inhibitor use increases risk of COVID-19 infection. And I'm going to switch to a graphic here from the study that makes it more interesting to the eye. And so this was a graphic from the study, and what the study found is that patients taking proton pump inhibitor medications, especially 2 doses a day, had a 3.7-fold increased risk of having a positive COVID-19 test. If a person's taking PPI drugs once a day, they have a 2.2-fold increased risk of a positive COVID-19 test. So being on the medications increase your risk of testing positive for COVID-19. And it's dose dependent. So the higher your dose, the higher your risk. Well, why? Well, if we return to the body of the study, you can see here that, quote, proton pump inhibitors increase the risk for enteric or GI infections, which is likely related to proton pump inhibitor induced hypochlorhydria. Hypochlorhydria is a term for low or insufficient stomach acid. So I'll return to their quote. Although the impact of acid suppression on severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2 is unknown thus far, prior data revealed that a pH less than or equal to 3 or more acidic, right, impairs the infectivity of the similar SARS-CoV-1 virus. Thus, this study aimed to determine whether use of proton pump inhibitors increase the odds for acquiring COVID-19 among community-dwelling Americans. And in their conclusions, they state, we found evidence of an independent dose-response relationship between the use of PPI medications and COVID-19 test positivity. So again, if you're on a PPI and you've been on it for longer than 2 weeks and you don't want to test positive for COVID, you may want to discuss with your prescribing provider what actions you should take. And again, the whole idea of COVID is not, hey, we need to wait for this blockbuster vaccine, because we know that's not going to happen. Sure, one will come out, but it's not going to be the blockbuster and the silver bullet that we hope it will be, just like no other vaccine ever has been or medication ever has been. The key is to promote optimal immune defenses and optimal physiology so that you can deal with coronavirus just like you deal with flu virus, just like you deal with any other virus. And as the study just said, optimal stomach acid is one way that you deal with it, right? If you can get a stomach acid at a pH less than 3, then you're impairing infectivity of viruses. You're impairing the ability for bacteria to survive your GI tract. You're impairing your ability to be infected as a whole. So optimal stomach acid production is key. PPIs decrease stomach acid production. Next study, proton pump inhibitors accelerate endothelial senescence. So you can see here that this study states that proton pump inhibitors have been associated with heart disease, kidney disease, and nervous system disease. I put out a video last year where I discussed that proton pump inhibitor medications have also been associated with liver cancer. So risk of liver cancer was added to the list April 2019, so just over a year ago, of potential side effects of proton pump inhibiting medications. how does one drug increase risk of death from so many different causes or so many different diseases to different organs? Well, this study from 2016 helps shed light on that, and this is really important. The title of the study is called Proton Pump Inhibitors Accelerate Endothelial Senescence. So what that means is endothelial cell death or aging. Senescence is aging or decaying, okay? And so in this study, the authors found that proton pump inhibitors, by reducing stomach acid secretion, impair acidification and enzyme activity. And if you're losing enzyme activity, you are not breaking down proteins, and these protein aggregates accumulate or build up and increase oxidative stress. And oxidative stress leads to endothelial cell dysfunction and shortening of telomeres. What the heck is that? You're saying a lot of big words. Okay, so on your DNA, you have things called telomeres. Picture your DNA as your shoelaces, okay? And the telomeres are the end caps on your shoelace, or where that tape is, right? The hard part that lets you feed it through the holes so you can lace your shoes. So those are telomeres. And every time your DNA replicates from birth to death, your telomere shortens, right? So once you're conceived and you're growing and your DNA's dividing and replicating, your telomeres are shortening. So every DNA division, the telomere shortens until at some point that tape on your shoelace gets so short that there's none left, and now you die. So that's called senescence. Well, this study found that telomere shortening and accelerated senescence are observed with proton pump inhibitor drug use. And so they conclude that chronic exposure of human endothelial cells to PPIs disturbs proteostasis, or protein and enzyme function, and accelerates the senescence. So long-term use of these medications increases aging, we could say, to keep it simple. And then whether that's heart disease in me, kidney disease in you, and nervous system disease in her, depends on our uniquenesses, right? So I may have a susceptibility to heart disease, so as my shoelaces shorten, then heart disease manifests sooner in me, whereas kidney disease may be what manifests in you, and liver cancer in her. So our individual uniqueness plays out in the end, but the proton pump inhibitor would be what accelerates the manifestation of that. And so, you know, that's the last study that I want to look at today. And to wrap it up, proton pump inhibiting medications can have a role in the right situation, but the research shows that 40 to 60% of the time they're prescribed for the wrong reason, that 14% of cases of depression in geriatrics could be prevented if we just stopped prescribing proton pump inhibitors. Heart disease, aging, liver cancer, kidney disease, all of these things could be reduced or prevented if we just prescribed properly and used them for short term and then got off as they were intended. They aren't intended to be used for long term. So that's the discussion for today. I'll open it up for questions.
Yeah, I mean, it's great information, pretty timely right now. And not really a question, but just more of a statement. So my dad's running through some issues right now with acid reflux, so I definitely want to show him this video. But I have heard that PPIs, can cause long-term damage. So definitely see that by the studies. But yeah, he's dealing with some issues and trying to get that resolved as we speak.
Good, and I wish you well and hope he does. And so again, sometimes proton pump inhibited medications for the short term are useful, but we want to think about it as, okay, if I'm using this for the short term, 2 weeks or less, hopefully we're also using that time to figure out what the real cause is, right? So we don't need to be on this long term or continue to suffer from those symptoms long term. So I hope that his care team is working on that as well.
Yeah, thank you.
And yeah, you're welcome. And just as a refresher, some things they might want to investigate would be, does he have H. pylori infection? Okay, that bacteria in the gut. Does he have stomach autoimmunity? Does he have immune imbalance that promotes a Th2 phenotype, which would be like an allergic type reaction or histamine type reactions, which can drive that. Does he have history as a smoker?
No, but definitely heavy soda drinker,
Okay.
and the diet's not really good.
Okay.
So that's probably what's causing it, but don't
Yeah.
know for sure.
So diet very commonly can cause it. Spicy foods, gluten is a common offender.
Okay.
So those would be things to investigate as well. So you could look at maybe IgE food allergy testing or IgG food sensitivity testing there, or just an elimination diet and see, hey, if he pulls out wheat gluten for a month, how does his heartburn symptoms respond?
Yeah.
Yeah, another possibility could be structural. So there's a thing called a hiatal hernia
Okay.
that your stomach or your esophagus is a tube, right, from your throat down to your stomach. And I can draw it for you better. Oh, actually, we got it right here. Okay, so here would be the esophagus coming down from your mouth.
Yeah.
Okay, and it connects to your stomach here, and then the stomach goes into the small intestine here. So if I get a pen, let's use. So right here is called the gastroesophageal sphincter. Okay.
Okay.
So there's a sphincter between the esophagus and the stomach, so that things should come down and be one way, right?
Mm-hmm.
But if things go back up, that's called reflux, right? So sometimes you have, so you see you have the sphincter and then you have stomach tissue leaving. Well, sometimes the stomach tissue like invaginates up in that sphincter so that the sphincter can't close all the way.
Mm-hmm.
So now you have, say, an open portal for things to reflux back up into. And that's called, when the stomach invaginates like that, that's called a hiatal hernia. So structurally, it's like it's folded
Yeah.
back up to prevent the sphincter from closing. So you can manually reduce that or pull the stomach down and reduce that hernia so that's no longer there.